My name is Dr. Ed Glazer. I'm the founder and CEO of Soul Supports Incorporated. I started this company over 25 years ago, and I based it on a single core value: we make people better. Before I was a podiatrist, I studied mechanical engineering at the State University at Stony Brook. I didn't complete my engineering degree, but I learned enough that when I got to podiatry school and I looked at what they thought happened in the foot, I realized it disagreed with physics and engineering. So I set out to reinvent the whole field of foot biomechanics and base it on Newtonian physics. You see, when I came along, arch supports were fairly flat. And I said, how could that support anything? It's flat. And they said, we tilt the ground in or out. I said, that doesn't make any sense. Why don't you raise the arch? And they said, it hurts. I said, because you're raising it halfway and letting the foot drop on it over and over again. The impact is what hurt. I said, why don't you start at the beginning of the range of motion? And they said, we don't know how hard to push. I said, Isaac Newton did. He said, for every action, there's an equal and opposite reaction. And I realized that a foot orthotic was just a plastic spring, and that I could calibrate that spring to deliver an equal and opposite force to the human body. But it's very important when you're doing that, not only to make it all the way up in the arch, but to make it the shape of the foot. So the cast is so integral to the orthotic. In this technology, the way you cast is exactly the shape of the orthotic, so you want to do it right. So this video will give you the fine instruction on how to cast, to make sure that you're doing it consistently, doing it correctly, and that will give you the best results for your patients, and decrease the amount of adjustments you make, the amount of warranties, the amount of returns, which are already quite low. But let's get the best cast we can for our patients, because after all, we're here for one purpose: to make people better. And a good cast will make a good orthotic. And without further ado, let's show you the casting technique. Feel free to review it several times and do it on each other. Once we get this right, we're going to make people better together. Thank you.
Remove the patient's shoes and socks, or stockings. Weigh the patient in clinic if possible. Correct weight is extremely important when calibrating the patient's Soul Supports orthotics. Please be sure the weight is accurate. Be sure to measure your patient's forefoot flexibility and enter it along with their weight on the orthotic design form. Please refer to the forefoot flexibility video in the Soul Supports Providers Information video playlist if needed. To start, if a non-slick surface isn't readily available, place a rubber mat such as a bath or doormat or even a rubber yoga mat under the casting box so that the knee and ankle remain aligned throughout the entire process. Have the patient sit at the edge of a stable surface, with thighs roughly parallel to the floor or casting surface. Make sure they relax. Sit straight up, looking ahead, and not try to help you or watch you as you cast. Place the casting box in front of the foot to be cast. Lift the patient's foot, placing it gently on top of the foam, centered front to back. Make sure the medial side of the heel and forefoot is about 1/2 an inch from the tallest edge of the foam box. Also, make sure the leg is not too far forward or back, but rather is vertical, perpendicular to the box when viewed from front and side. Once the knee is in the proper position, gently move the box to align the second metatarsal with the middle of the thigh. You are now ready to bottom out the heel. Be careful not to let the knee slide outwards or inward as you push down. With the opposite hand of the foot being cast, grasp and raise the navicular before grounding out the heel. A good way to remember which hand to use is that the hand of the same-sided knee will always be thrusting or doing the work. The best body mechanics are to be in a lunge position. This allows you to use the full force of your upper body, not just the strength of your arm. From the lunge position, lean and thrust quickly and cleanly to seat the heel. Also, be very careful when bottoming out the heel to thrust straight down. Use enough force to bottom out the heel in the foam in one stroke. If you are not sure you made it all the way down, give another quick thrust straight down through the knee to see if any more movement is possible. Locate the head of the 5th metatarsal. Place your fingers hand over hand on top of the head of the 5th metatarsal, and using a quick, clean thrust, bottom out the 5th metatarsal into the foam. Now push the toenails all the way down. Make sure the patient doesn't try to assist you and lift their heel when bottoming out the toes and metatarsals. Place your left thumb on the 1st metatarsal as shown, and place the other thumb on the medial malleolus, and push slightly up. Bottom out the 1st metatarsal, pushing it down and back into the foam. Put your thumbs close over the remaining met heads, one by one, pushing down and back to bottom them out. Carefully lift the foot out of the foam. Repeat the process on the left foot. Now check your cast. Check the rear foot area for vertical walls. If the heel appears to be inverted or everted in the foam, and there is a shelf of foam over the medial or lateral rear foot, you will need to recast. This means that the knee was allowed to move, and the leg entered the foam at an angle during heel thrust. Now use a conical tip pen to test the depth of your impressions at the center of the heel, 1st and 5th met heads. A cone tip will make a progressively larger hole in the foam the deeper it goes. So if the cast was bottomed out correctly in these 3 critical areas, you should see roughly the same size hole in each place. If one area has a clearly larger hole than the others, that area was left too high. This can be easily corrected by carefully reinserting the foot in the foam and bottoming out the high spot. Take extra care not to depress any arch foam as you reinsert the foot and bottom out the high spot. After completing the pen test, gently press and run your fingers along the side of the heel cup as shown to ensure that the sides of the heel cup have been properly bottomed out as well. Once you are sure that all areas have been properly bottomed out and the conical pen has left the holes roughly the same size, you're done. You are now ready to design the orthotics and scan the casts for upload to the Soul Supports lab. Be sure to fill out the design form completely. If you don't have the Mass 3D application to scan the casts, please refer to the packing and shipping video in the Soul Supports Providers Information video playlist for the proper packing and shipping procedure.